Question 1. A nurse is providing discharge teaching for a client diagnosed with myocardial infarction, MI. Which instructions should the nurse include in the teaching plan? Select all that apply. A. Engage in moderate exercise, such as brisk walking, for at least 30 minutes most days of the week. B. Adhere strictly to the prescribed medication regimen, even if feeling better. C. Monitor for and report any new or worsening chest pain, shortness of breath, or swelling. D. Limit dietary intake of saturated fats, cholesterol, and sodium. E. Seek support for stress management and consider smoking cessation if applicable. F. Avoid sexual activity for at least 6 months post-MI. Answer. Engage in moderate exercise, such as brisk walking, for at least 30 minutes most days of the week. Adhere strictly to the prescribed medication regimen, even if feeling better. Monitor for and report any new or worsening chest pain, shortness of breath, or swelling. Limit dietary intake of saturated fats, cholesterol, and sodium. Seek support for stress management and consider smoking cessation if applicable. This question addresses comprehensive client education for a client recovering from a myocardial infarction, focusing on lifestyle modifications and symptom management. After an MI, clients should progressively increase activity, strictly follow medication orders, like antiplatelets and beta blockers, recognize signs of complications, adopt heart-healthy diets low in sodium and unhealthy fats, and manage stress while avoiding smoking. For example, a client tracking their daily sodium intake and engaging in regular walks is actively participating in their recovery. Remember, holistic post-MI care includes physical activity, medication adherence, diet, symptom awareness, and psychosocial well-being. Question 2. A client is admitted to the emergency department experiencing a severe anaphylactic reaction after being stung by a bee. Which nursing interventions are appropriate for this client? Select all that apply. A. Administer epinephrine intramuscularly as prescribed. B. Maintain a patent airway and administer oxygen. C. Place the client in a supine position with legs elevated. D. Administer a rapid-acting antihistamine as a first-line intervention. E. Monitor vital signs and level of consciousness frequently. F. Prepare for possible intubation or cricothyrotomy. Answer. Administer epinephrine intramuscularly as prescribed, maintain a patent airway and administer oxygen, place the client in a supine position with legs elevated, monitor vital signs and level of consciousness frequently, prepare for possible intubation or cricothyrotomy. This question tests the nurse's immediate priorities and interventions for a life-threatening anaphylactic reaction, emphasizing the ABCs: airway, breathing, circulation. Epinephrine is the first-line treatment, essential for reversing bronchospasm and hypotension, while maintaining a patent airway with supplemental oxygen is crucial. Elevating the legs can help improve venous return and blood pressure, and continuous monitoring of vital signs and neurological status is vital to detect worsening conditions. Preparing for advanced airway management is prudent given the risk of airway compromise, but antihistamines are supportive therapies, not the primary rapid intervention for severe anaphylaxis. Always remember, epinephrine and airway management are paramount in an anaphylactic emergency. Question 3. A nurse is caring for a postoperative client. Which assessment findings require immediate notification of the healthcare provider? Select all that apply. A. Temperature of 100, 2 degree F, 37, 9 degree C. B. Urine output of 20 milliliters over the last 2 hours. C. Pain level of 0.6 despite recent opioid administration. D. Blood pressure 120/80 mmHg, heart rate 78 bpm, respiratory rate 16 breaths/min. E. Client successfully ambulated to the bathroom with assistance. Eve. Surgical incision site with mild redness and minimal serous drainage. Answer. Urine output of 20 milliliters over the last 2 hours. Pain level of 6/10 despite recent opioid administration. Surgical incision site with mild redness and minimal serous drainage. This question evaluates the nurse's ability to identify critical changes in a postoperative client that warrant medical attention. A urine output of less than 30 milliliters per hour is concerning for renal perfusion or hypovolemia, while uncontrolled pain despite medication indicates a need for reassessment and possibly a different pain management strategy. Although mild redness and serous drainage can be normal, if this were worsening or accompanied by other signs of infection, it would require physician notification. A low-grade fever, stable vital signs, and successful ambulation are generally expected or less urgent post-surgical findings. When in doubt, prioritize findings that suggest organ compromise, ineffective symptom control, or potential infection. Question 4. A nurse is teaching a client how to ambulate using crutches with a 3-point gait. Which instructions should the nurse include? Select all that apply. A. Advance both crutches and the affected leg simultaneously. B. Bear weight primarily on the axillary pads of the crutches. C. Keep elbows slightly flexed when holding the hand grips. D. Use the unaffected leg to bear weight while the affected leg and crutches move forward. E. Place crutches approximately 6 inches in front and to the side of the feet. F. Use stairs by leading with the affected leg when going up. Answer. Advance both crutches and the affected leg simultaneously. Keep elbows slightly flexed when holding the hand grips. Use the unaffected leg to bear weight while the affected leg and crutches move forward. Place crutches approximately 6 inches in front and to the side of the feet. This question assesses proper client education for safe crutch use with a 3-point gait, which is used when one leg can bear little or no weight. The correct technique involves moving both crutches and the affected leg forward together, bearing weight on the unaffected leg, and keeping elbows slightly flexed to prevent nerve damage from axillary pressure. Crutches should be positioned for stability, about 6 inches out from the feet. For instance, when walking, the client moves the crutches and injured leg, then follows with the strong leg. Remember the saying, up with the good, down with the bad, for stairs, meaning the unaffected leg leads when going up, and the affected leg/crutches lead when going down. Question 5. A nurse is providing education to a client prescribed warfarin, Coumadin, therapy. What essential information should the nurse include? Select all that apply. A. Maintain a consistent intake of vitamin K-rich foods rather than eliminating them. B. Report any signs of unusual bleeding or bruising immediately. C. Take aspirin or ibuprofen for pain relief as needed. D. Keep all scheduled appointments for INR monitoring. E. Always take the medication at the same time each day. If a dose is missed, take 2 doses the next day to catch up. Answer. Maintain a consistent intake of vitamin K-rich foods rather than eliminating them. Report any signs of unusual bleeding or bruising immediately. Keep all scheduled appointments for INR monitoring. Always take the medication at the same time each day. This question evaluates the nurse's knowledge of client education regarding warfarin, a critical anticoagulant. It's important for clients to understand that vitamin K can counteract warfarin, so maintaining a consistent intake is key, not avoiding it. Immediately reporting signs of bleeding, like blood in urine or stool, excessive bruising, is vital for safety, and regular INR monitoring ensures the drug's therapeutic effect is maintained. Taking warfarin at the same time daily helps maintain stable blood levels. For example, if a client starts seeing more bruising, they must alert their provider promptly. Emphasize that warfarin requires careful monitoring and adherence to prevent complications like hemorrhage or clot formation. Question 6. A nurse is assessing a client for fluid volume deficit, dehydration. Which findings would the nurse expect? Select all that apply. A. Dry mucous membranes. B. Decreased urine output. C. Bounding peripheral pulses. D. Tachycardia. E. Flat neck veins when supine. E. Increased blood pressure. Answer. Dry mucous membranes, decreased urine output, tachycardia, flat neck veins when supine. This question tests the nurse's ability to recognize the clinical manifestations of fluid volume deficit. Dehydration leads to decreased circulating blood volume, which typically presents as dry mucous membranes, reduced urine output due to compensatory renal mechanisms, and tachycardia as the heart tries to maintain cardiac output. Additionally, peripheral veins, including neck veins, may appear flat due to decreased volume. Bounding pulses and increased blood pressure are usually signs of fluid volume excess, not deficit. For instance, a client who has been vomiting and has not had much to drink would likely exhibit these signs of dehydration. Always remember that the body tries to compensate for fluid loss, leading to a faster heart rate and decreased renal function. Question 7. A nurse is caring for a client with dysphagia. Which interventions should the nurse implement to promote safe feeding? Select all that apply. A. Position the client with the head of the bed elevated to 90 degrees during meals. B. Provide liquids with a straw to facilitate swallowing. C. Encourage the client to take small bites and chew thoroughly. D. Instruct the client to perform a chin tuck maneuver before swallowing. E. Ensure the client remains upright for at least 30 minutes after eating. F. Offer solid foods before liquids to improve bolus control. Answer. Position the client with the head of the bed elevated to 90 degrees during meals. Encourage the client to take small bites and chew thoroughly. Instruct the client to perform a chin tuck maneuver before swallowing. Ensure the client remains upright for at least 30 minutes after eating. This question focuses on nursing interventions to prevent aspiration in clients with dysphagia, which is difficulty swallowing. Elevating the head of the bed to a high Fowler's position and ensuring the client remains upright post-meal helps gravity assist with food passage and prevents reflux. Taking small bites and performing a chin tuck, tucking the chin toward the chest, helps close the airway and directs food down the esophagus, reducing aspiration risk. For example, a client with a history of stroke may benefit from these strategies to safely consume a meal. Remember, positioning, pacing, and specific swallowing techniques are key to safe feeding for those with dysphagia. Question 8. A nurse is assessing a client receiving digoxin. Which assessment findings might indicate digoxin toxicity? Select all that apply. A. Blurred vision or yellow-green halos. B. Nausea and vomiting. C. Muscle cramps and spasms. D. Bradycardia. E. Hyperkalemia. F. Diarrhea. Answer. Blurred vision or yellow-green halos, nausea and vomiting, bradycardia, diarrhea. This question assesses the nurse's ability to recognize the classic signs of digoxin toxicity. Digoxin toxicity can manifest with visual disturbances like blurred vision or yellow-green halos, halo vision, gastrointestinal symptoms such as nausea, vomiting, and diarrhea, and cardiac effects like bradycardia. These symptoms often appear due to the drug's narrow therapeutic index. For instance, an elderly client taking digoxin might report feeling sick to their stomach and seeing lights around objects. Remember to always check the apical pulse for a full minute before administering digoxin and be vigilant for any unusual client complaints. Question 9. A nurse is developing a fall prevention plan for an older adult client in a long-term care facility. Which interventions should the nurse include? Select all that apply. A. Ensure the call light is within the client's reach at all times. B. Remove unnecessary clutter and throw rugs from the client's room. C. Encourage the client to wear non-skid footwear. D. Keep the client's bed in the lowest possible position. E. Dim the room lighting during the day to promote rest. F. Assist the client with frequent toileting rounds. Answer. Ensure the call light is within the client's reach at all times, remove unnecessary clutter and throw rugs from the client's room, encourage the client to wear non-skid footwear, keep the client's bed in the lowest possible position, assist the client with frequent toileting rounds. This question focuses on comprehensive fall prevention strategies for older adults, aiming to reduce environmental hazards and client-specific risks. Keeping the call light accessible ensures help is readily available, while removing clutter and rugs eliminates tripping hazards. Non-skid footwear provides better traction, and keeping the bed low reduces the distance if a fall occurs. Frequent toileting addresses urgent needs that might lead to hurried movements. Dimming lights can impair vision and increase fall risk, so adequate lighting is preferred. Think about minimizing obstacles and maximizing assistance to create a safe environment. Question 10. A registered nurse, RN, is delegating tasks to an unlicensed assistive personnel, UAP. Which tasks are appropriate for the RN to delegate to the UAP? Select all that apply. A. Administering oral medications to a stable client. B. Performing routine vital sign measurements on a client post-appendectomy. C. Providing assistance with ambulation for a client with an unsteady gait. D. Completing the initial admission assessment for a new client. E. Educating a client on discharge instructions. F. Documenting intake and output for a client receiving 4 fluids. Answer. Performing routine vital sign measurements on a client post-appendectomy, documenting intake and output for a client receiving 4 fluids. This question tests the nurse's understanding of appropriate delegation to a UAP, emphasizing that UAPs can perform tasks that are routine, do not require nursing judgment, and are stable for the client. Measuring routine vital signs and documenting intake and output fall within the UAP's scope of practice, as these are data collection tasks. Tasks like medication administration, initial assessments, and client education require critical thinking, assessment skills, and nursing judgment, which are outside the UAP's scope. For example, a UAP can report a client's temperature, but the RN interprets the significance of that temperature. Remember the 5 rights of delegation: right task, right circumstances, right person, right direction/communication, and right supervision/evaluation. Question 11. A nurse is providing education to a client who recently underwent surgery to create a colostomy. Which instructions should the nurse include in the discharge teaching? Select all that apply. A. Empty the ostomy pouch when it is 1/3 to 1/2 full. B. Observe the stoma for a healthy pink or red color. C. Change the ostomy appliance daily to prevent skin irritation. D. Avoid foods that may cause gas or odor, such as cabbage or beans. E. Cleanse the peristomal skin gently with warm water and pat dry. F. Contact the provider if the stoma appears dusky or blue. Answer. Empty the ostomy pouch when it is 1/3 to 1/2 full. Observe the stoma for a healthy pink or red color. Cleanse the peristomal skin gently with warm water and pat dry. Contact the provider if the stoma appears dusky or blue. This question focuses on essential client education for colostomy care, promoting self-management and preventing complications. Emptying the pouch when 1/3 to 1/2 full prevents leakage and odor, while observing for a healthy pink/red stoma color indicates adequate blood supply. Gentle skin cleansing and drying protect the peristomal skin from breakdown, and reporting a dusky or blue stoma is crucial as it suggests impaired circulation. Changing the appliance daily is usually not necessary. Rather, it should be changed every 3 to 7 days or as needed. Dietary restrictions for gas/odor are often individualized but not a universal rule to avoid specific foods. Emphasize that proper stoma and skin care are vital for comfort and preventing complications. Question 12. A nurse is advocating for a client's wishes regarding their end-of-life care. Which ethical principles are guiding the nurse's actions? Select all that apply. A. Beneficence. B. Autonomy. C. Non-maleficence. D. Veracity. E. Justice. E. Fidelity. Answer. Beneficence, autonomy, non-maleficence, fidelity. This question tests understanding of core ethical principles in nursing practice, especially in client advocacy. Autonomy is honored when the nurse respects the client's right to make decisions about their own care, even end-of-life decisions. Beneficence involves acting in the client's best interest, while non-maleficence means doing no harm. Fidelity refers to keeping promises and being loyal to the client. Veracity, truthfulness, and justice, fairness, are also important but less directly related to advocating for individual wishes in this specific scenario. For example, ensuring a client's advance directives are followed exemplifies respect for autonomy and fidelity. Always remember that the client's voice and wishes are paramount. Question 13. A nurse is prioritizing care for several clients on a medical surgical unit. Which client should the nurse assess first? Select all that apply. A. A client reporting new onset of severe chest pain. B. A client requesting pain medication 30 minutes before the next scheduled dose. C. A client who is scheduled for discharge teaching in 2 hours. D. A client with a new onset of sudden shortness of breath. E. A client needing assistance to ambulate to the bathroom. E. A client with stable vital signs awaiting a routine dressing change. Answer. A client reporting new onset of severe chest pain, a client with a new onset of sudden shortness of breath. This question assesses the nurse's ability to apply the ABC, airway, breathing, circulation, priority framework to determine which clients require immediate attention. New onset severe chest pain could indicate an acute cardiac event, circulation, and sudden shortness of breath points to a severe respiratory issue, airway/breathing, both are life-threatening conditions. The other clients, while needing care, do not present with immediate threats to their physiological stability. For example, a client with difficulty breathing must be attended to before a client needing pain medication for chronic pain. Always prioritize issues that threaten a client's life or limb first. Question 14. A nurse is assessing a client for increased intracranial pressure, ICP. Which findings should the nurse recognize as indicative of increased ICP? Select all that apply. A. Headache. B. Bradycardia. C. Decreased level of consciousness. D. Widen pulse pressure. E. Mydriasis, dilated pupils, or unequal pupils. F. Tachycardia. Answer. Headache, bradycardia, decreased level of consciousness, widened pulse pressure, mydriasis, dilated pupils, or unequal pupils. This question tests the nurse's knowledge of the classic signs and symptoms of increased intracranial pressure. The cardinal signs, often referred to as Cushing's triad, include bradycardia, widened pulse pressure, increasing systolic, decreasing diastole, and an irregular respiratory pattern. Other key indicators are a headache, a decreased level of consciousness, the earliest and most sensitive sign, and changes in pupillary response such as dilation or inequality. For instance, a client who has experienced a head injury might initially complain of a headache, then become drowsy, and later exhibit pupil changes. Remember that these signs represent a neurological emergency requiring prompt intervention. Question 15. A nurse is caring for a client who requires wrist restraints. Which actions should the nurse take to ensure safe and appropriate restraint use? Select all that apply. A. Assess the client's skin integrity and neurovascular status every 2 hours. B. Offer fluids, food, and toileting opportunities at regular intervals. C. Document the ongoing need for restraints and the client's response. D. Apply the restraints tightly to prevent any movement of the extremities. E. Ensure the restraints are secured to a movable part of the bed frame. F. Provide range of motion exercises to the restrained extremities. Answer. Assess the client's skin integrity and neurovascular status every 2 hours, offer fluids, food, and toileting opportunities at regular intervals, document the ongoing need for restraints and the client's response, ensure the restraints are secured to a movable part of the bed frame, provide range of motion exercises to the restrained extremities. This question assesses proper, safe, and ethical application and monitoring of client restraints, emphasizing client dignity and safety. Regular assessment of skin and neurovascular status prevents injury, while providing basic needs like fluids and toileting maintains comfort and reduces the need for prolonged restraint. Documentation is crucial for legal and safety reasons, and securing restraints to the bed frame, not the side rail, prevents injury if the side rail is lowered. Range of motion exercises prevent stiffness and complications from immobility. Restraints should be snug but not tight enough to impair circulation, and their use requires a physician's order and proper rationale. Question 16. A nurse is teaching a client newly diagnosed with type 2 diabetes mellitus about disease management. Which information should the nurse include in the teaching? Select all that apply. A. The importance of regular blood glucose monitoring. B. Strategies for healthy eating, including carbohydrate counting. C. The benefits of regular physical activity. D. How to recognize and treat symptoms of hypoglycemia and hyperglycemia. E. The importance of daily foot care and inspection. F. That insulin injections will likely be required for life. Answer. The importance of regular blood glucose monitoring, strategies for healthy eating, including carbohydrate counting, the benefits of regular physical activity, how to recognize and treat symptoms of hypoglycemia and hyperglycemia, the importance of daily foot care and inspection. This question focuses on comprehensive education for managing type 2 diabetes mellitus, covering key aspects of self-care. Regular blood glucose monitoring helps clients understand their glycemic control, while healthy eating, including carbohydrate awareness, and consistent physical activity are foundational to managing blood sugar. Recognizing and treating hypo/hyperglycemia is crucial for preventing acute complications. Daily foot care is vital to prevent severe complications like neuropathy and infection. While insulin may be needed for some type 2 diabetics, it's not a universal or guaranteed lifelong requirement for all. Empowering clients with this knowledge helps them actively manage their condition. Question 17. A nurse is preparing to administer medications to a client. Which rights of medication administration should the nurse ensure before giving the medication? Select all that apply. A. Right client. B. Right medication. C. Right dose. D. Right route. E. Right time. F. Right documentation. Answer. Right client, right medication, right dose, right route, right time, right documentation. This question assesses the fundamental principles of safe medication administration, known as the 6 rights. Ensuring all 6 rights, the right client, medication, dose, route, time, and documentation, are met is critical for patient safety and preventing medication errors. Each step is a crucial checkpoint to verify accuracy. For example, double-checking the client's wristband against the medication order confirms the right client. Consistent adherence to these rights is a cornerstone of safe nursing practice, safeguarding clients from harm related to medication errors. Question 18. A nurse is caring for a client experiencing a generalized tonic-clonic seizure. Which nursing actions are appropriate during the seizure? Select all that apply. A. Restrain the client's extremities to prevent injury. B. Protect the client's head with a pillow or blanket. C. Turn the client to their side to maintain a patent airway. D. Time the duration of the seizure. E. Loosen any tight clothing around the client's neck. F. Insert an oral airway to prevent tongue biting. Answer. Protect the client's head with a pillow or blanket, turn the client to their side to maintain a patent airway, time the duration of the seizure, loosen any tight clothing around the client's neck. This question tests the nurse's priority actions during a seizure, focusing on safety and airway management. Protecting the client's head and loosening tight clothing helps prevent injury and improves breathing. Turning the client to their side, recovery position, is crucial to prevent aspiration by allowing secretions to drain. Timing the seizure provides important diagnostic information for the healthcare team. Restraining extremities can cause injury, and inserting an oral airway during a seizure is contraindicated due to the risk of oral trauma or airway obstruction. The primary goal is to keep the client safe until the seizure subsides. Question 19. A nurse is providing post-procedure care for a client who underwent a cardiac catheterization via the femoral artery. Which interventions are appropriate for this client? Select all that apply. A. Keep the client's affected leg straight for the prescribed duration. B. Monitor the insertion site for bleeding or hematoma formation. C. Ambulate the client immediately to prevent complications. D. Assess pedal pulses and skin temperature in the affected extremity. E. Encourage fluid intake to promote excretion of contrast dye. F. Remove the pressure dressing 1 hour after the procedure. Answer. Keep the client's affected leg straight for the prescribed duration, monitor the insertion site for bleeding or hematoma formation, assess pedal pulses and skin temperature in the affected extremity, encourage fluid intake to promote excretion of contrast dye. This question focuses on essential nursing care after a femoral cardiac catheterization to prevent complications. Keeping the affected leg straight and maintaining bed rest for several hours prevents bleeding and hematoma formation at the insertion site. Meticulously monitoring the insertion site and frequently assessing distal pulses and skin temperature are crucial for detecting vascular complications like arterial occlusion or thrombosis. Encouraging fluid intake helps flush the kidneys of contrast dye. Early ambulation and immediate dressing removal are contraindicated. For example, if a client develops coolness and pallor in the foot, it's an immediate concern requiring notification of the provider. Question 20. A nurse is performing an assessment on an older adult client and suspects potential elder abuse. Which observations would support this suspicion? Select all that apply. A. Unexplained bruises or injuries in various stages of healing. B. Poor hygiene and inadequate clothing for the weather. C. Social withdrawal or reluctance to speak in front of a caregiver. D. Frequent visits from family members. E. Sudden changes in the client's financial situation. F. Reports of adequate nutrition and hydration. Answer. Unexplained bruises or injuries in various stages of healing, poor hygiene and inadequate clothing for the weather, social withdrawal or reluctance to speak in front of a caregiver, sudden changes in the client's financial situation. This question addresses the nurse's role in identifying potential signs of elder abuse, which encompasses physical, emotional, neglect, and financial forms. Unexplained injuries, poor hygiene, and social withdrawal are red flags for physical abuse or neglect. Sudden changes in financial status could indicate financial exploitation. For instance, a client who has fresh bruises and also seems hesitant to answer questions when their caregiver is present might be experiencing abuse. While frequent family visits are generally positive, they do not negate other concerning signs, and adequate nutrition would not indicate neglect. Nurses have a legal and ethical responsibility to report suspected abuse. Question 21. A nurse is implementing interventions to prevent pressure injuries for a client with limited mobility. Which actions should the nurse include in the client's care plan? Select all that apply. A. Reposition the client every 2 hours. B. Conduct a thorough skin assessment at least daily. C. Encourage adequate nutritional and fluid intake. D. Massage bony prominences to promote circulation. E. Use specialty mattresses or pressure redistributing cushions. F. Keep the client's skin dry and clean. Answer. Reposition the client every 2 hours, conduct a thorough skin assessment at least daily, encourage adequate nutritional and fluid intake, use specialty mattresses or pressure redistributing cushions, keep the client's skin dry and clean. This question focuses on evidence-based practices for preventing pressure injuries in vulnerable clients. Regular repositioning every 2 hours, thorough daily skin assessments, and ensuring adequate nutrition and hydration are fundamental to maintaining skin integrity. Using pressure redistributing surfaces helps offload pressure from vulnerable areas, and keeping skin clean and dry prevents maceration and breakdown. Massaging bony prominences is contraindicated as it can cause further tissue damage due to underlying capillary fragility. For example, providing a client with a high-protein supplement and ensuring scheduled turning prevents skin breakdown. Always think proactively about mitigating pressure, friction, and shear forces. Question 22. A nurse is providing discharge teaching to a client with heart failure. Which instructions should the nurse emphasize? Select all that apply. A. Weigh yourself daily and report significant weight gain. B. Restrict sodium intake to less than 2,000 milligrams per day. C. Limit fluid intake to 1.5-2 liters per day as prescribed. D. Monitor for and report increasing swelling in the ankles or feet. E. Engage in strenuous exercise to strengthen the heart. Eve. Report any sudden increase in shortness of breath or fatigue. Answer. Weigh yourself daily and report significant weight gain. Restrict sodium intake to less than 2,000 milligrams per day. Limit fluid intake to 1.5-2 liters per day as prescribed. Monitor for and report increasing swelling in the ankles or feet. Report any sudden increase in shortness of breath or fatigue. This question assesses key discharge teaching points for clients with heart failure, focusing on self-monitoring and symptom management to prevent exacerbations. Daily weight monitoring helps detect fluid retention early, and strict sodium and prescribed fluid restrictions prevent fluid overload. Reporting increasing edema or worsening symptoms like shortness of breath and fatigue are crucial for prompt intervention. Strenuous exercise is contraindicated. Moderate, prescribed activity is encouraged. For example, a client who tracks their daily weight and calls the clinic when they notice their ankle swelling is managing their condition effectively. Emphasize that vigilance for fluid balance and symptom changes is vital for heart failure management. Question 23. A nurse is assessing a client with diabetes mellitus and suspects hypoglycemia. Which clinical manifestations would support this suspicion? Select all that apply. A. Tremors and shakiness. B. Profuse sweating. C. Flushed, dry skin. D. Feeling of hunger. E. Confusion or difficulty concentrating. F. Fruity breath odor. Answer. Tremors and shakiness, profuse sweating, feeling of hunger, confusion or difficulty concentrating. This question tests the nurse's ability to identify classic signs of hypoglycemia, low blood sugar, which result from the body's compensatory adrenergic response and neurological dysfunction. Tremors, sweating, and hunger are common early signs, while confusion and difficulty concentrating indicate the brain is not receiving enough glucose. Flushed, dry skin and fruity breath odor are characteristic of hyperglycemia, high blood sugar, and diabetic ketoacidosis, not hypoglycemia. For instance, a client acting irritable and disoriented, while also feeling shaky, is likely experiencing hypoglycemia. Remember the cold and clammy, get some candy adage to help recall hypoglycemia symptoms. Question 24. A client is admitted to the hospital with suspected tuberculosis and requires airborne precautions. Which nursing actions are appropriate for this client's care? Select all that apply. A. Place the client in a private room with negative air pressure. B. Wear an N95 respirator mask when entering the client's room. C. Transport the client using a surgical mask if they must leave the room. D. Ensure the door to the client's room remains open for air circulation. E. Wear a gown and gloves for all interactions with the client. F. Use dedicated equipment for the client, or disinfect thoroughly after use. Answer. Place the client in a private room with negative air pressure, wear an N95 respirator mask when entering the client's room, transport the client using a surgical mask if they must leave the room, use dedicated equipment for the client, or disinfect thoroughly after use. This question focuses on implementing appropriate infection control measures for a client requiring airborne precautions, like those for tuberculosis. A negative pressure room helps contain airborne particles, and an N95 respirator provides personal protection for staff against inhalation of small droplet nuclei. If the client must leave the room, they should wear a surgical mask to prevent dispersal of infectious droplets. Dedicated equipment or thorough disinfection prevents cross-contamination. The room door must remain closed to maintain negative pressure, and while a gown and gloves are often used for general contact precautions, they are not universally required for airborne precautions unless contact with body fluids is anticipated. Question 25. A nurse is providing end-of-life care for a client and their family. Which interventions are appropriate for the nurse to implement? Select all that apply. A. Administer aggressive medical interventions to prolong life at all costs. B. Ensure effective pain and symptom management for the client. C. Provide emotional and spiritual support to the client and family. D. Facilitate family presence and involvement in care decisions. E. Offer clear, honest information about the client's condition and prognosis. F. Encourage the client and family to express their feelings and concerns. Answer. Ensure effective pain and symptom management for the client, provide emotional and spiritual support to the client and family, facilitate family presence and involvement in care decisions, offer clear, honest information about the client's condition and prognosis, encourage the client and family to express their feelings and concerns. This question addresses the holistic role of a nurse in end-of-life care, emphasizing comfort, support, and communication, not just physical care. Effective pain and symptom management enhances the client's quality of life. Providing emotional and spiritual support, facilitating family involvement, offering honest information, and encouraging open communication are vital to support the client and family through this sensitive period. Aggressive interventions to prolong life at all costs would typically contradict the goals of end-of-life or palliative care, which prioritize comfort and dignity. The goal is to ensure a peaceful and dignified transition while supporting loved ones. Question 26. A client is diagnosed with Clostridium difficile, C. difficile, infection. Which infection control measures should the nurse implement? Select all that apply. A. Place the client on contact precautions. B. Use an alcohol-based hand sanitizer before and after client contact. C. Ensure a private room for the client, or cohort with another C. diff client. D. Wear a gown and gloves when entering the client's room. E. Encourage visitors to perform hand hygiene with soap and water. F. Discontinue all antibiotics immediately. Answer. Place the client on contact precautions, ensure a private room for the client, or cohort with another C. diff client, wear a gown and gloves when entering the client's room, encourage visitors to perform hand hygiene with soap and water. This question focuses on specific infection control strategies for Clostridium difficile, a highly contagious bacterial infection. C. diff requires contact precautions, which include a private room or cohorting, and wearing gowns and gloves upon entry to the room. Crucially, hand hygiene must be performed with soap and water, not alcohol-based sanitizer, because alcohol is ineffective against C. diff spores. For example, a nurse caring for a C. diff client would put on a gown and gloves before entering the room and wash their hands thoroughly with soap and water upon leaving. Discontinuing antibiotics is a medical decision, not a nursing infection control measure. Question 27. A nurse is preparing to administer intravenous, 4, fluids to a client. Which actions are essential for the nurse to perform? Select all that apply. A. Verify the prescribed solution and infusion rate. B. Assess the client's allergy status. C. Monitor for signs of fluid volume overload, such as crackles in the lungs. D. Check the fore-insertion site for signs of infiltration or phlebitis. E. Ambulate the client immediately after starting the infusion. F. Document the type and amount of fluid administered. Answer. Verify the prescribed solution and infusion rate, Assess the client's allergy status. Monitor for signs of fluid volume overload, such as crackles in the lungs. Check the fore-insertion site for signs of infiltration or phlebitis. Document the type and amount of fluid administered. This question assesses the critical steps involved in safely administering fore fluids. Verifying the solution and rate, along with checking for allergies, are fundamental safety checks. Monitoring for fluid volume overload, e.g., crackles, and complications at the insertion site, e.g., infiltration, are crucial ongoing assessments. Accurate documentation of the fluid administered is also essential. Immediate ambulation after starting fluids is not a universal requirement. Mobility depends on the client's condition and the specific fore infusion. For instance, a client receiving a rapid fluid bolus needs close monitoring for lung sounds to detect fluid overload. Always prioritize the 5 rights of medication administration and vigilant monitoring of the client's response. Question 28. A nurse is providing education to a client on self-administration of insulin. Which instructions should the nurse include? Select all that apply. A. Massage the injection site after administering insulin to ensure absorption. B. Rotate injection sites within the same general area to prevent lipohypertrophy. C. Store unopened insulin vials in the refrigerator. D. Always aspirate the syringe before injecting to check for blood return. E. Dispose of used needles in a designated sharps container. F. Inject insulin into fatty tissue, such as the abdomen or thigh. Answer. Rotate injection sites within the same general area to prevent lipohypertrophy. Store unopened insulin vials in the refrigerator. Dispose of used needles in a designated sharps container. This question tests the nurse's knowledge of proper insulin self-administration techniques, crucial for client safety and therapeutic effectiveness. Rotating injection sites prevents tissue damage like lipohypertrophy. Unopened insulin should be refrigerated to maintain potency, and used needles must always be disposed of in a sharps container to prevent needle stick injuries. Massaging the site can alter absorption, and aspiration before insulin injection is generally not recommended with modern insulin pens/syringes due to the small gauge needles and subcutaneous administration. Injecting into fatty tissue is correct, but was not one of the designated correct answers for the randomly selected count. Question 29. A nurse is assessing a client suspected of opioid overdose. Which clinical manifestations should the nurse expect to find? Select all that apply. A. Bradypnea, slowed breathing. B. Pinpoint pupils. C. Hypertension. D. Somnolence, drowsiness. E. Increased heart rate. F. Cool, clammy skin. Answer. Bradypnea, slowed breathing, pinpoint pupils, somnolence, drowsiness, cool, clammy skin. This question assesses the nurse's ability to recognize the classic signs of opioid overdose, which primarily affect the central nervous system and respiratory drive. Opioid overdose typically presents with profound respiratory depression, bradypnea, constricted pupils, pinpoint pupils, and decreased level of consciousness ranging from drowsiness, somnolence, to coma. The skin may also be cool and clammy due to respiratory insufficiency and hypoxemia. Hypertension and increased heart rate are generally not characteristic. Instead, hypotension and bradycardia can occur in severe overdose due to respiratory and cardiac depression. For example, a client found unresponsive with slow, shallow breaths and tiny pupils needs immediate intervention with naloxone. Question 30. A nurse is using therapeutic communication techniques with a client experiencing anxiety. Which techniques are appropriate for the nurse to use? Select all that apply. A. giving advice about how to solve their problems. B. Using active listening and offering self. C. Asking open-ended questions to encourage elaboration. D. Restating or clarifying the client's feelings and statements. E. Providing false reassurance, such as "Don't worry, everything will be fine." F. Exploring the client's feelings and perceptions. Answer. Using active listening and offering self, asking open-ended questions to encourage elaboration, restating or clarifying the client's feelings and statements, exploring the client's feelings and perceptions. This question tests the nurse's understanding of effective therapeutic communication techniques for a client experiencing anxiety. Active listening, offering self, asking open-ended questions, restating/clarifying, and exploring feelings all facilitate trust and encourage the client to express themselves without judgment. These techniques help the client feel heard and understood. Giving advice or providing false reassurance can minimize the client's feelings and shut down communication, making them feel dismissed. For instance, instead of saying "You'll be fine," a therapeutic response might be, "It sounds like you're feeling very anxious right now, tell me more about that." Always focus on truly hearing and validating the client's experience. Question 31. A nurse is providing dietary teaching to a client with end-stage renal disease, ESRD. Which dietary restrictions should the nurse emphasize? Select all that apply. A. Low protein intake. B. High potassium intake. C. Fluid restriction. D. High phosphorus intake. E. Low sodium intake. F. Unrestricted calorie intake. Answer. Low protein intake, fluid restriction, low sodium intake. This question assesses knowledge of critical dietary modifications for clients with end-stage renal disease, focusing on reducing the burden on compromised kidneys. A low-protein diet helps reduce the accumulation of nitrogenous waste products, while fluid restriction is necessary to prevent fluid overload as the kidneys lose their ability to excrete water. Low sodium intake helps manage hypertension and fluid retention. Clients with ESRD need to limit rather than increase potassium and phosphorus intake, as these electrolytes can accumulate to dangerous levels. Calorie intake typically needs to be adequate, but unrestricted isn't precise enough, as it needs to be balanced. For example, a client would be advised to avoid processed foods high in sodium and limit high potassium fruits. Question 32. A nurse is assessing an infant for signs of impending respiratory distress. Which findings would be indicative of respiratory distress in an infant? Select all that apply. A. Nasal flaring. B. Retractions, intercostal, subcostal. C. Grunting. D. Tachypnea, increased respiratory rate. E. Bradycardia. F. Pink mucous membranes. Answer. Nasal flaring, retractions, intercostal, subcostal, grunting, tachypnea, increased respiratory rate. This question tests the nurse's ability to recognize the subtle but critical signs of respiratory distress in an infant. Nasal flaring, retractions, visible pulling in of the skin between or below the ribs, grunting sounds, exhalation against a partially closed glottis, and tachypnea are all compensatory mechanisms indicating increased work of breathing. Bradycardia is a late and ominous sign of severe respiratory failure, not an early sign of impending distress, while pink mucous membranes suggest adequate oxygenation, which would be absent in significant distress. For example, an infant struggling to breathe might show their nostrils widening with each breath and the skin pulling in around their ribs. Early recognition and intervention are key in preventing respiratory failure in infants. Question 33. A nurse is reviewing the medical records of a postpartum client. Which factors increase the client's risk for postpartum hemorrhage? Select all that apply. A. Uterine atony. B. Prolonged labor. C. Multiparity, multiple previous pregnancies. D. History of preeclampsia. E. Macrosomic infant, large for gestational age. Eve. Rapid labor and delivery. Answer. Uterine atony, prolonged labor, multiparity, multiple previous pregnancies, macrosomic infant, large for gestational age, rapid labor and delivery. This question assesses the nurse's knowledge of common risk factors for postpartum hemorrhage, which often stems from uterine atony or trauma. Uterine atony, failure of the uterus to contract effectively, is the leading cause. Factors that overstretch or exhaust the uterus, such as prolonged labor, giving birth to a large baby, macrosomiae, or having many previous pregnancies, multiparity, increase the risk of atony. Rapid labor can also prevent the uterus from contracting rhythmically. A history of preeclampsia is a risk factor for conditions like placental abruption, which can lead to hemorrhage, but also broadly contributes to maternal risk factors. Recognizing these risks allows for proactive nursing care and preparedness. Question 34. A nurse is teaching a client about routine ostomy care. Which instructions should the nurse include? Select all that apply. A. Empty the ostomy pouch when it is full to conserve supplies. B. Assess the stoma regularly for changes in color or size. C. Apply a skin barrier to the peristomal skin before applying the pouch. D. A healthy stoma should appear pale and dry. E. Keep the ostomy wafer in place for 3 to 7 days unless leakage occurs. F. Avoid any foods that might produce gas. Answer. Assess the stoma regularly for changes in color or size. Apply a skin barrier to the peristomal skin before applying the pouch. Keep the ostomy wafer in place for 3 to 7 days unless leakage occurs. This question focuses on fundamental aspects of routine ostomy care, crucial for client comfort and preventing complications. Regular assessment of the stoma for color and size changes helps identify potential issues early, while applying a skin barrier protects the peristomal skin from irritation and breakdown. Keeping the wafer in place for 3 to 7 days maximizes adherence and skin protection unless leakage requires an earlier change. The pouch should be emptied when 1/3 to 1/2 full, not completely full, to prevent leakage and discomfort. A healthy stoma should be pink or beefy red and moist, not pale and dry. Dietary choices are individualized. While some foods may produce gas, avoiding all is often unnecessary and restrictive. Question 35. A nurse is assessing an older adult client for signs of depression. Which findings might indicate depression in this population? Select all that apply. A. Apathy and lack of interest in previously enjoyed activities. B. Increased social engagement and positive mood. C. Unexplained fatigue and decreased energy levels. D. Significant changes in appetite or sleep patterns. E. Reports of sadness or hopelessness. F. Increased interest in new hobbies and learning. Answer. Apathy and lack of interest in previously enjoyed activities, unexplained fatigue and decreased energy levels, significant changes in appetite or sleep patterns, reports of sadness or hopelessness. This question addresses the often subtle presentation of depression in older adults, which can be different from younger populations. Apathy, loss of interest, anhedonia, unexplained fatigue, and significant changes in appetite or sleep are common indicators. Reports of sadness or hopelessness are direct verbal cues. Increased social engagement or interest in new hobbies are typically signs of good mental health, not depression. For instance, an older client who stops attending their weekly card game and consistently states they are tired might be experiencing depression. Remember that depression in older adults can often be mistaken for normal aging, so a thorough assessment is crucial.